Tafoya and the business of better care. St. Louis isn't the first place people look when talking about healthcare innovation. It's not a biotech hub. It doesn't have a valley. But quietly, in one of the city's diagnostic labs, a former nurse is reshaping how care gets delivered, not with new tech, but by fixing what already exists. Tafoya doesn't fit the usual mold of a business development executive. He started his career in direct care, working as a nurse in Washington, D.C., treating patients with complex psychiatric and physical conditions. Today, he's based in St. Louis, Missouri, serving as a business development executive at Midwest Innovation Laboratory. His job: make the lab work better. Logistics, partnerships, service recovery, client retention. The basics, but done well. Labs don't usually make headlines. They're back-end operations, often invisible to patients. But the people running them can have a major impact on how fast and accurately care is delivered, especially in under-resourced or rural areas. That's where Tafoya has focused his attention. His work is unglamorous, full of root cause analysis, revised intake protocols, and repeated conversations with partners. It's also measurable. In one case, a major account was lost due to communication issues during a transition. Before St. Louis, Tafoya spent years in research-focused roles. He worked on Dendrion's cancer immunotherapy trials, specializing in stem cell apheresis, a delicate, high-stakes procedure. He performed with a 100% success rate. The precision required in that work carries over to his current role, but so does something less technical: relationship management. His background helps. He holds a Bachelor of Science in Nursing from George Washington University and a Bachelor of Arts in Philosophy and Psychology from the University of Colorado, Denver. It's not a standard mix, but it gives him range: clinical, operational, and ethical. Tafoya doesn't shy away from talking about what's gone wrong. Early in his career, he lost a research contract due to poor follow-through. "I was trying to do everything. I didn't have systems." That loss led to a complete overhaul of how he manages his workflow. He now uses tools like OneNote, breaks down goals into steps, and treats organization as a daily habit. That change didn't just make him more productive, it gave him room to think. Tafoya believes the industry's focus on short-term metrics, especially cost-cutting, is short-sighted. He's also skeptical of over-standardized mental health care. These aren't abstract ideas. They come from years of working with underserved populations, including volunteer work with International Medical Relief, where he supported Venezuelan refugees in Colorado. He's keeping an eye on biologics and immunomodulation, treatments with huge potential for patients with rare diseases. He's also staying rooted in the day-to-day realities of lab operations. Tafoya doesn't see himself as a disruptor. He's not chasing a spotlight. What he's doing: making labs more reliable, making systems less fragile, doesn't usually get press. But in places like St. Louis, where healthcare depends more on consistency than buzzwords, that kind of work matters. It's not a revolution. It's just good care, rewired from the inside out.